coming to the different types of pain. We can classify pain into acute pain and chronic pain. And again, we can classify it into nociceptive pain, neuropathic pain, phantom pain, and psychogenic pain. In acute pain usually comes on suddenly and hello.
pregnancy तो खैर नहीं आई बेटे
Acute pain is usually comes on suddenly and is caused by something specific. Acute pain usually doesn't last longer than 6 months. The pain usually becomes less severe as the injury begins to heal. In chronic pain is a condition wherein the body constantly sends pain signals to the brain even when the injury has healed. The pain lasts longer than 6 months, then it is called as chronic pain. The pain persists even after the injury heals. Then, coming to the acute and chronic pain again. Acute pain is directly related to the soft tissue injury, sprained ankle or a paper cut. Resolves as the injury tissue heals. In chronic pain, it is the long term of the illness, cancer, degenerative diseases, fibromyalgia, inflammatory diseases. In these cases, mostly the pain will be chronic. In nociceptive pain, can be divided into 3 types. It is a radicular pain which occurs when the nerve roots are irritated, goes down from your arms or legs, causes numbness, weakness, and tingling. So it can be a somatic pain also. It happens when any of the pain receptors in your tissue such as muscles, bones, or skin are activated. Example, headache, cuts, etc. In visceral pain also is a nociceptive pain. Happens when the internal organs such as involuntary muscles in the heart are injured or inflamed, described as aching. Then other pain causes are bruises, burns, cuts, fractures, or broken bones. Pain caused by joint damage such as arthritis or sprain. Next, coming to the neuropathic pain, often is the result of a nerve damage or a malfunctioning nervous system. It comes as often as a shooting or burning pain. Example, chemotherapy, diabetic neuropathy, shingles, trigeminal neuralgia, etc. Then coming to the phantom pain, pain is felt in a part of the body that has been lost or from which the brain no longer receives signals. This is a type of neuropathic pain. Example is a pain from an amputated hand. Then psychogenic pain also as there, pain caused or increased or prolonged by mental, emotional or behavioral factors. Example, headache, stomach ache, back pain and sometimes psychogenic. Then this nociceptive pain, neuropathic pain and other pains together can create a hell in a patient because of the pain. Pain can be sometimes we use these most common use of the tools. Most commonly used tools for the visualization for the recording of the pain is visual analog scale or phases pain rating scale. These 2 scales are most commonly we use in hospitals for rating of the pain. Analysis of the pain can be done according to the site of the pain, radiation of the pain, severity of the pain, timing and duration of the pain, character of the pain, occurrence or aggravation of the pain, and relief of the pain. The pain terminology used in Ayurveda. The common terminology used in Ayurveda are Vedana, Leda, Vyatha, Shila, Dukkha, Soda, Veda, and These are the terminology used in Ayurveda for the pain. Coming to the Chikitsa part. For pain management, we can do Shodhana Chikitsa, Shamana Chikitsa, and also Ahara and Achara also. Different kinds of Ahara and Achara also we can use in the management of pain. And in Shodhana Chikitsa comes Anda Parimarjana, Bahi Parimarjana, also Shastra Pranidhana. In Anda Parimarjana, comes under the Panchakarma therapies, that is Vamana, Virechana, Vasthy, Nasya, also Raktamoksha. In Bahi Parimarjana, that is Abhyanga, Svedana, Parishega, Udvarthana, Dhara, Pizhichil, etc., Karaliya Chikitsa, etc., all comes under the Bahi Parimarjana. Importance of Purva Karma. It brings the Shaghagata dosha to Koshta to detach the Leena dosha from, it helps to detach the Leena dosha from the Dhadus. It also helps in Utkleshana of the dosha. Sometimes it minimizes the strain. It also helps in prevent the Vada Pragoba. It also prevents the complication. In Panchakarma, importance of Panchakarma in Vedana Prasamana is, it helps in the bio-cleansing, it is a bio-cleansing regimen. It helps in better bioavailability of the pharmacological therapies. Then it is a homeostasis of the, it helps in the homeostasis of the dosha also. And what is meant by Keraliya Panchakarma? It is nothing but Kerala special procedures combined with the Panchakarma. Kerala special procedures, what we commonly use here are Pizhichil, then Jambira Pindasveda, etc., Manjalkiri, etc., different kinds of potleys and all, combined with the Vasthy, Nasya, etc., Panchakarma procedure is known as, we can commonly call it as Keraliya Panchakarma. Then Kerala special procedures, they are the modified therapeutic procedures of Snehana and Svedana. It can be done as Purva Karmas and as Shamana Chikitsa in specific conditions. Kerala, these are some of the Kerala special procedures. Shirodhara we do in 3 types: Tailadhara, Takradhara, and Shirodhara. That's different kinds. And Kayasega, there is a modified version of Kayasega known as Pizhichil, what we do here. Then Pindasveda, what we commonly use to Pindasvedas are Shashtika Pindasveda, Churna Pindasveda, Patra Potlasveda, and Jambira Pindasveda. In Annaleba, Navaratepa is Shashtika, Shali, paste we will be applying on the body. Then another one is Shirolepa. Shirolepa is we commonly use one is Nellika, but that is gooseberry. Then Purundoti, that is Bala. Bala paste, which will be used on the head. Coming to the Vasthy. Vasthy Vada Harananam Shrestha, as we all know. There is no pain without Vada. So Vasthy with disease-specific and Vedanahara medicines make the pain relief, also called as Artha Chikitsa. Vasthy is also known as Artha Chikitsa. Then commonly used Kashaya Vasthy in our hospitals are, one is Dipanja Muladi Vasthy or Dashamula Kashaya Vasthy, then Madhudailika Vasthy, Erenda Muladi Vasthy, Balaguluchadi Vasthy, Churna Vasthy. In Churna Vasthy we use either Shadharana Churan or Brihatvaishwandra Churan and sometimes Trifala Churan also. These Churnavasti we usually do in the acute stages, in acute pain conditions. Then again, Vaidarana Vasti. These are the common Vasti dravas that we use here in our hospital. Then Anuvasana Vasti or Matra Vasti. The commonly used drugs for Anuvasana Vasti or Matra Vasti are Dhanandram Medupagam, Sahajaradi Medupagam, Sadahwadi Vastitailam, Tiktavirva, etc. Then coming to the Virechana. Panchakarma Virechana. Sometimes we do Snehapana and then Virechana. Sometimes we go for Sadhya Virechana, but sometimes Nitya Virechana, according to the condition of the patient and the disease. Virechana Aushadas, commonly used here in our hospital, one is Gandharva Astadi Erenda Taila, another one is Trivrit Leham, then Dashamula Haridagi Leham, Mistraga Sneham, Avipatti Churnam. These are the commonly used Virechana Aushadas. The importance of Virechana. It is the most popular and commonly employed Shodhana therapy. It is the easiest administration, least complication, easy to perform. It has maximum efficiency. Then it is a wide field of utility, highly cost effective. That is the importance of Virechana in pain management. Then coming to the Nasyam. Here the medicaments are administered through the nose. Then it is mainly administered in Jatrurdhagada Yogas. The best method to eliminate and alleviate the vitiated doshas of Uttamanga is Nasya. The better chance of absorption through blood vessels are there if we administer medicine through Nasya. Then gives Snehana, Svedana, and Shodhana together. Then Brahmana, Shamana, and Shodhana according to the 3 types of Nasya are there. One is Brahmana Nasya, Shamana Nasya, and Shodhana Nasya. Commonly used Nasya drugs are, one is Anutaila, Kshirabala, Dhanandram 101, then Maharaja Prasarnadalam. These are the commonly used Nasya Dravyas, Nasya drugs here in our hospital. Then coming to the Raktamokshana, Veluga Avajarana, Alabu, then Stringa, Prachana, Siravyatha, all these things can be used in Raktamokshana for pain relief. Raktamokshana is commonly used in Pitta Rakta Prasadana, Dushta Rakta Shodhana, and Vadanulomana. It checks the inflammation, it improves the circulation, and it cures venous diseases and thrombosis. Also, it helps in pain relief also. Coming to the Abhyanga. The biological effect is brought about by the combined action of the medicine, the temperature, and the force or pressure due to the massage. Here, the oil medium decreases friction, gentle movement increases the surface contact, reduces the surface tension, liquefies sebum, and favors drug entry. Relieve pain because of rubefacient action applied over the toxins accumulated in the neurolemma. Then medicaments suppresses the nerve impulse to reach the pain center. The most common example used for Abhyanga are most common drugs which we use here for Abhyanga are, one is Mahanarayana Thailam, Dhanandran Thailam, Murivenna, Prabhanjana Vimardhanam Kuzhambu, Karpuradi Thailam, Vadamardhanam Kuzhambu, Balashugandhal Thaila, Mahamasha Thaila, etc. According to the patient condition and disease condition. Coming to the pindas here for pain relief. Churna Pindaseda, Patra Pindaseda, Jandira Pindaseda, Shastikishari Pindaseda, and Manjal Kiri, Valuga Seda, etc. is commonly used for pain relief according to the patient condition and disease condition. Selection of medicine is usually based on the basic disease that produces the pain. Heat makes local area inflamed, so the blood rushes to the local area, supplies more nutrition to recover. Vasodilation facilitates the toxins to transfer from Shava to the coast. And coming to the Dhanyamla Dhara, we commonly use here for acute pain relief. Here, the Vada Rogas, especially with the Kafanubandha. In that case, we use, if there is an Amanubandha, then we usually go for Dhanyamla Dhara. And also in diabetic neuropathy, also Dhanyamla Dhara gives good results. It relieves spasticity, cervical spondylosis, lumbar spondylosis, and it helps in OA&E with the edema also. Acute, subacute joint diseases also will be, in acute and subacute joint diseases also, Dhanyamla Dhara can be helpful. Acute, subacute inflammation and pain also, Dhanyamla Dhara can be helpful. It relieves pain, stiffness, and swelling associated with arthritis and other painful conditions. It is highly effective in combating ama. Local fermentation with Dhanyamla can be given to relieve pain also. That is also very effective in acute pain conditions. Coming to the Pizhichil. Pizhichil is a modified form of Kaya Sega developed by Kerala Vaidya and is extensively practiced in Kerala. The Snigdha Sweda, in which warm medicated oil is poured all over the body, squeezed in a cotton cloth, dipped in oil, followed by gentle massage. In Kaya Sega, we don't give massage to the body, but we can consider it as a combination of Kaya Sega plus Abhyanga. The duration, what we commonly give here is 1 hour. And the procedure is warm the prescribed thaila for head by Patrabhaga technique. Then warm the prescribed thaila for body around 42 to 45 degrees according to the comfort of the patient. Ask the patient to sit comfortably on the drawing with legs extended. Take position on either side of the patient. Apply the prescribed thaila all over the vertex. Apply thaila all over the back, then all over the body. Soak a cotton cloth in warm thaila and squeeze it with the right hand from around 8 cm above the body, allowing the warm thaila to flow as a dhara through the right thumb to the patient's body. Massage the patient body with the left hand in anulomana direction at the same time. So here, dhara also is happening and massage also is happening. Continue massage in the sitting posture for 5 minutes. Then ask the patient to lie in supine position and continue the procedure. These are the common positions what we use here for the Ayurveda. Then according to the patient condition, we may use the prone position also in some cases. After completing the procedure, wipe off thyla and sweat from the head to the body with a clean and dry towel after the stipulated time. Then apply Rasnadi Churna on the vertex. Ask the patient to take rest for 1 hour. Then the indications are Vada Vikaras, Vada Anubandha Rogas, Ababahuga, Tadaja Vikara, Adigraha, Vridrasi, and neuromuscular disorders, hemiplegia, scoliosis, avian, OA cases, chronic RA cases, all these things we can use the Ayurveda. The effects of Ayurveda are it enhances the immunity and strength of the body. Development of the complexion, anti-aging and rejuvenating, ensures better blood circulation, soothing and relaxing. It is also a soothing and relaxing procedure.
Ma'am, your voice is. Ma'am, your voice is not audible.
Hello. Hello.
Hello.
Hello. Am I audible now?
Yes, ma'am.
Okay.
Hello.
Hello. Am I audible?
Yes, ma'am. Yes.
Okay. Thank you.
Yes, ma'am.
Coming to the Kadivasti or Grivavasti, it's a type of local Snigdha Sweda. It is Shulahara also, Strodho Vivarana, then Vada Shamana, Nadi Belya, rejuvenation kind of thing, etc. Then it indicates in Kadigraha, Gridrasi, degenerative disease of the spine, IVDP, scoliosis cases, compression fracture cases, spondylosis, listhesis cases, cervical spondylosis, etc. Then coming to the Shirodhara. Shirodhara is a procedure in which various liquids are continuously poured over the forehead and then allowing to flow over the scalp from a specific height. Here, according to the disease condition, we can select Thaila, medicated Kshira or medicated Takra. In Vada Pragoba cases, commonly we use Thaila, and according to the climatic condition also, we in cold climates we prefer Thailadhara. And in Pitta Koba cases, we prefer Kshira Pagas, especially Panjagandha Kshira and all used for Pitta Pradhana cases. And Kapha Pradhana cases, we prefer Takra, medicated Takra. Then, just a picture of the Takra. Then, the impact of Shirodhara on pain act as a hypnotic and sedative along with pain center suppression. It is beneficial in psychological pain also. Shirastoda, Shirodaha, Nidranasha, Arthava Bedaka, migraine, etc. cases, Shirodhara can be useful. Coming to the Ubanaha. Ubanaha means to tie or bandage. It's a type of Eganga Sweda. Indications are chronic Sandigada Vada, OA, Vada Kandaga, calcaneus etc., IVDP, Shula, Sangoja, Stambha, tennis elbow, frozen shoulder, etc. cases, we can use Ubanaha. Duration of the bandage or Ubanaha should be minimum 1 hour to 12 hours. Here we don't keep Ubanaha more than 1 hour. In some rare cases, we use for 1.5 to 2 hours, but mostly after 1 hour, we remove the Ubanaha. Then coming to the Leba, it is the external application of medicated paste. It is a passive method. It lasts for a long time. It is easy to apply. The commonly used drugs for Leba are Kottanjukkadi Churna, Jadamayadi Churna, etc. Then coming to the Agni Karma. Agni Karma or therapeutic cauterization is a parasurgical procedure where actual heat is transmitted into the tissue to nullify the disease, resulting coagulative necrosis of the tissue. It's a sterile procedure and is considered to be superior among the other management. Simple, fast, economical, and effective technique that gives immediate pain relief. Some of the internal medications we use for the pain relief are, you may take a screenshot of this thing. It can be useful in many cases. Example, Rasna Saptakam Kashayam. It is it will be very useful in acute low back pain cases. The best option is Rasna Saptakam Kashayam. Then is Dashamulam Kashayam, Cheri Rasnadi Kashayam, Vali Rasnadi Kashayam, Ashtavargam Kashayam, which can be useful for the best in cervical spondylosis cases, frozen shoulder cases. Ashtavargam Kashayam can be used. Best thing. Then Sahajaradi Kashayam, Sahajaradi Kashayam, again radiating pain to the legs from lower back, from the lumbar spine. Lumbar area. That is best options are Sahajaradi Kashayam, Sahajaradi Kashayam, and Rasna Saptakam Kashayam. Then Mustadi Marma Kashaya in fracture cases also. Acute, very acute, like a gym injury type of gym injury or low back pain caused by fall. In those cases, Mustadi Marma Kashaya along with the Gandhataila is a very effective combination. Then in some cases, Gulgulitang Kashayam, then Kogilakshagam Kashayam also can be used. Kogilakshagam Kashayam specifically in uric acid cases, that gouty pain, gouty arthritis and all, it will be very effective. Kogilakshagam Kashayam. Then Churnas. Churna Prayogas, what we commonly use here are Brihat Vaishwanara Churna, Panchakola Churna, Hingoshtaka Churna, Shadharana Churna. See here, Brihat Vaishwanara Churna, Shadharana Churna, and all will be really helpful in Amavada conditions, especially in if the even the rheumatoid arthritis cases associated with the fever. In these cases also, Brihat Vaishwanara Churnam and Shadharana Churnam, even Panchagola Churna, Hingoshtaka Churna also can be used in the initial cases. Even we here use the Shadharana Churna or Brihat Vaishwanara Churna as Churna Vasthy also. We mix 10 gram of Shadharana Churna or Brihat Vaishwanara Churna in around 250 ml or 300 ml of lukewarm water, or boil it in 300 ml of water, and then we administer it as a Vasthy, Churna Vasthy. That also gives instant pain relief in acute rheumatoid arthritis, which is associated with a fever and all. Fever, loss of appetite and all. Then, coming to the tablet form of medications, Yogaraja Gugulu, Kaishora Gugulu, Vada Gajangushirasa, Agni Kumarasa, Chariya Andhra Kudara, Shadharana Churan tablet, Surya Prabha, Vittumaran. All these things we commonly use here for pain relief. In acute back pain cases, as I explained earlier, like in a gym injury or after a fall or after an accident or something like that, or if patient comes, we can use Rasna Saptakam Kashayam along with the Gandhatailam capsules before food, and after food we can give Yogaraja Gugulu, Surya Prabha, etc. tablets. Yogaraja Gugulu commonly we use the dose as 2 tablets twice daily after food, and Surya Prabha also 2 tablets twice daily after food. This is a standard combination that we can use in acute lower back pain cases. Then coming to the other tablets, one is Ruco tablet, Osteocot tablet, Migracot tablet, and Yaksha Gugulu. This Osteocot is actually a tablet form of Rasna Saptakam Kashayam itself. If some patients tell you like, I don't like Kashayam, I don't want to drink this bitter Kashaya and all, then in that case you can give Osteocot tablet. Then coming to the Arishta and Asavas, the commonly used Arishtas and Asavas are, one is Dashamula Arishta, Bala Arishta, Amrita Arishta, Imbamrita Asava. Amrita Arishta along with the Vettumaran tablet or Amrita Arishta along with Agni Gumar Rasam Guliga has proven result in acute rheumatoid arthritis cases with fever or loss of appetite and all. We can give Amrita Arishta along with the Surya Prabha or Vettumaran Guliga. Then Grida. We commonly used Gridas in pain management. One is Varanadi Grida, Gulguludiktaga Grida, Rasnadi Grida. Then external medications commonly used here for the pain management are Mahanarayana Taila, Valiya Sajradi Taila, Murivenna. There are lots of things. Dhanandaram, Avartana, then Karpuradi, Kottanjukkadi, Pinda Tailam, Badamardhanam, Goyamba. Among these, the most important one is Murivenna. Murivenna we can use in even it is in acute pain also, chronic pain also. It is best helpful. It will be the most help. It will be most helpful in acute painful conditions, especially in lower back pain, neck pain, frozen shoulder. In all these cases, Murivenna can be used. But if it is used as a combination with Valiya Sahajradi Thailam. One another Thailam is there, is not mentioned here. Valiya Sahajradi Thailam. Murivenna can be used with the Valiya Sahajradi Thailam in lower back pain radiating to legs and all. That will be really helpful. But if it is used along with the Karpasasthe Thaila you might have heard. So Murivenna along with the Karpasasthe Thaila will be helpful in Urdhanga Rogas, especially in neck pain, shoulder pain, upper back pain and all. This combination will give you wonders. So sure. Then in acute cases, in some acute cases, acute pain cases, go for the combination of Murivenna along with the Karpuradi. That also is a wonderful combination in acute pain stages. And see, if in some cases, like in if the patient is above 75, old age patients like 75 plus say, 80 plus say, in that cases, Murivenna won't be working in pain case. Even in the knee pain also, Murivenna alone won't be giving that much result. In that case, you can combine Murivenna either with Dhanandaram Thailam or Dhanandaram Kolambu or along with the Mahanarayana Thailam and all. Otherwise, along with Dhanandra Avartana 7 or Dhanandra Avartana 21 with the Murivenna will give you good results. And this Kottanjukkal Thailam, Pinda Thailam and all will be giving good results in rheumatoid arthritis cases. Then coming to the some other products of us like Rucot liniment, Rucot plus cream, Rucot gel, pain balm, pain spray, Dhanandaram cream. These also are we are commonly using these products also here in our hospital for pain management. Another products are Kottanjukkadi Churnam, Jadamayadi Churnam, Nagaradi Churnam, Rasnadi Churnam, Valiya Marmaguliga, Karthaguliga. These also you take a screenshot and keep. It will be really helpful in your daily practice. This Kottanjukkadi Churnam, Jadamayadi Churnam, mix with lukewarm water and ask the patient to apply on the painful areas. Will be most helpful in rheumatoid arthritis cases. Kottanjukkadi Churnam, Jadamayadi Churnam, Nagaradi Churnam. These three churnas along with Rasnadi Churna also. Okay. These churnas in osteoarthritis cases also, if there is edema and all, slightly swelling and all are there, then you can go for this combination. Kottanjukkadi Jadamaya, either Kottanjukkadi Jadamayadi or Kottanjukkadi Rasnadi or Nagaradi Churn along with Rasnadi Churn and all. In combination also you can give. Mix with lukewarm water and ask the patient to apply on the affected area. Keep it for 1 hour or 1.5 hours and ask them to remove it with warm water. That's another external application thing is Valiya Marmaguliga and Karthaguliga. These two things are also very helpful in acute pain management. See, if some injury happened or if you suspect some gym injury or tendon tear or ligament tear and all has happened, then patient comes, only one knee I am getting severe pain and that too after a sprain I am getting the pain and all. Then you can go for the Valiya Marmaguliga, Karthaguliga. These are hard tablets. Okay, hard tablets. So ask the patient to dip it in warm water for at least for 6 to 8 hours. That much time is needed to make it soft. Hello. I hope I am audible. So then you can ask the patient to apply this.
Dr. Maninder Palkar, please close your mic. Dr. Maninder Palkar,
Okay.
mic बंद
Thank you,
कर
sir.
दें, please.
Then Valiyamarma Guliga and Karta Guliga, ask them to soak in warm water for 6 to 8 hours. By that time, it will be soft. Then, along with that water, ask them to make it a lukewarm, semi-solid paste and ask the patient to apply it on the affected area, especially the ligament tear injuries, then acute back pain cases, and also in most importantly in coccyx pain cases. In coccyx pain cases, usually many of the other medications won't work. Even Murivenna also won't be giving expected result in coccyx pain, that tailbone pain cases. In that case, this Valiyamarma Guliga and Karta Guliga will definitely work. Then these are some of the pictures of the medications that I have already explained now. Common diseases and their treatments. This also, if doctors, if you can please take a screenshot of this slide, it will be helpful for you for future references. See here, Gugulidiktagam Kashayam, Sahajaradi Kashayam, Chirirasnadi, Valiyarasnadi, and all I have written here. The condition I will explain. Okay. This Gugulidiktagam Kashayam, Sahajara can be useful if it will be very useful in osteoarthritis cases along with the Gandha Thailam capsule. Before food, Gugulidiktagam Kashayam and Gandha Thailam capsule. Here, what we usually check is if the patient is below 60 years and if the patient is a little bit of obese kind of person, slightly swelling and all are associated, then go for Gugulitam Kashayam along with the Gandha Thailam. Then after food, you go for Yogaraja Gugulu and Surya Prabha. If Surya Prabha or Agni Kumar Rasam also will work. This combination will definitely work in osteoarthritis cases below 60 years and little bit of obese patient. Then, if the patient is above 60 or 65-year-old, the patient is thin, like not obese and all, in that case, you can go for either Maharasnadi Kashaya or Valirasnadi Kashaya, or you can opt Dhanundaran Kashayam also. In that case, you go for Gandha Thailam capsule, Gandha Thailam capsule or Dhanundaram 101 capsule along with this Valirasnadi Kashayam or Dhanundaram Kashayam. And after food, you can again give Yogaraja Gugulu and Surya Prabha. Surya Prabha is not necessary. You use Surya Prabha only in acute cases. If the pain is severe or it's an acute case, then only you go for Surya Prabha. Otherwise, no need of Surya Prabha in the prescription. Yogaraja Gugulu itself will work after food. Then these are some of the, that is one combination what we use here. And in external application also, Murivenna can be definitely used in osteoarthritis in combination with Valiyasahajradi Thailam or Karpuradi Thailam or Kottanjukkadi Thailam and all in below 60-year-old cases. But in old age cases like 65, 70 and plus and all, you go for Murivenna plus Dhanandaram Thailam or Dhanandaram Kuzhambu. That will work. Or otherwise, you can go for Murivenna with Mahamash Thailam or Murivenna with Dhanandaram 21 or like that Avartana, Dhanandaram 21 or Sahajradi 21 or Sahajradi 7 and all you can use for osteoarthritis cases. Some other things, medicines, treatments what we can give in osteoarthritis cases are: one is Churna Pindasveda, Pizhichil, Shashtikashali Pindasveda, Ragi Kiri, Upanaham, Janu Vasthy. Then Panchakarma we usually do Erandamula Divasti, Dipanjama Divasti and all according to the condition of the patient. What we commonly use here in osteoarthritis cases are: one is Pizhichil. Then, as it is a degenerative disease, we usually go for Pizhichil, Ragi Kiri, Januvasti and all commonly. This Shashtikashali Pindasveda also, some cases we do. Churna Pindasveda according to the condition of the patient, according to the severity and the, if there is swelling and all, then we may go for Churna Pindasveda, but it is less used in osteoarthritis cases. Then in lumbar spondylosis, here internal medicines, these are the common internal medications what we use. I have already explained Dhanadram Kashayam, Sahajrabaladi Kashayam, Cheri Rasnadi Kashayam, Shirabala, Yogaraja, Gugulu Suvarna Muktadi, Rasnadi Grudam, Uglita Grudam, etc. And these are some of the combination for external medicines also, Mahanarayana Thailam, Mitkarpuradi and all. Coming to the lumbar spondylosis treatments, Pizhichil, Jambira Pindasveda, Churna Pindasveda, Kadi Vasthy, Dipanjamuradi Vasthy, Madhuri Vasthy, according to the patient condition, we use. In cervical spondylosis, again, Ashtavargam Kashayam, as along with the Shirabala 101, either Avartana or with the capsule will give you wonders. Same way, Prasaranyadi Kashaya also with Maharaja Prasarani capsule. Then Suvarna Muktadi Guliga, if numbness is associated with that, you can use Suvarna Muktadi Guliga. Rasnadi Krudam or in chronic cases, or if Amavastha is not associated, then you can go for Rasnadi Krudam also. Then external application, you can definitely go for Karpasasthe Thaila, Murivenna, Vali Prasarana Thaila, Dhanadra Thaila, according to the condition of the patient. If the case is acute, if you suspect Kapha Verna, then go for Karpasasthe Thaila and Murivenna. Also, Ashtavargam Kashayam and Shirabala. Do not go for Prasaranyadi Kashayam in that stage. Then, coming to cervical spondylosis treatments, what we commonly use here are Pizhichil, Churna Pindasveda, Jambira Pindasveda, Shirovasti, Grivavasti, Nastya, etc. In Nastya, we use usually Shirabala 101, Maharaja Prasarana Thailam. These are the two Nastya Dravas, and in some cases, Anuthaila also used for cervical spondylosis. And in coming to the diabetes mellitus, these are some of the medicines that we use here in diabetes mellitus related conditions. In migraine cases, I'll explain this in detail. These are some of the medications which we use here commonly in migraine cases. One is Patyaksha Dhatriyadi Kashaya, Migracot tablet, Varanadi Gratam, Agni Kumarasam, Suvarna Muktadi Guliga, Dashamula Haridaki Leham. In external application, we may use Palahadadi Thailam, Shirabala, Migracot oil and all. Yeah. Let me explain. Doctors, here migraine cases, in most of the migraine cases, what we hear and get in OPD and IPD, in 90-95% of the cases, this migraine is directly associated with your digestive system. Okay, in North India, there is a according to normally that common people, what do here is like they eat either they skip the breakfast or take the breakfast like after 10 o'clock or 11 o'clock. It's a common practice here among the normal layman people here. So what they do is they do in morning they may get up at 5 o'clock, 6 o'clock or something like that, and then they do their house course and all, and then go for a bath, and then by that time they may take one tea and 2-3 biscuits or something like that, 1 or 2 rusk and all. That's it. For ladies, I'm saying. Then they will do their bath, then they will go for the puja, and after all these things, only they will be going taking the breakfast. By that time, it will be 10:30 or 11 o'clock, or even 12 o'clock also. See, this much time, gastric irritation will be happening. If it becomes chronic, it will lead to migraine. Or again, they will take medicine for migraine, painkillers and all. Again, it will give gastric irritation. Then gradually, this cycle will be a vicious cycle. It will be increasing. There is no exit. So in that case, first of all, you educate the patient to change the lifestyle first, and then only this medicines will work. Whatever it is, even if you give Patyashadatriyadi Kashaya, Migracot, and all this combination, if you try also, if the patient is not changing their lifestyle, there won't be any effect. So first of all, ask the patient to change the lifestyle. Rule out for the other brain lesions and all, and after that, ask if there is if brain lesions and all are not there, means then ask the patient to check the lifestyle of the patient and then ask the patient to change the lifestyle. And also, you can give Pathyakshidatriyadi Kashaya. Very, very good combination along with Mahadhanandaram Guliga, which is not written um, in the screen. Mahadhanandaram Guliga. Pathyakshidatriyadi Kashaya along with Mahadhanandaram Guliga will give you wonders in migraine cases. Then Migracode tablet also. Migracode tablet is actually Pathyakshidatriyadi Kashaya only in tablet form. Then in some cases, Varanadi Gridam, Varanadi Kashayam, Varanadi Kwadam also will be helpful. Agni Kumar Rasa also will help. In Suvarna Muktadi Guliga, Dashamula Haridiki Leham, all these things will be helpful. For external application, overhead, on head, you can suggest Bala Hadadi Thailam, Shirabala 101, 121, Shirabala 7, or Migracode oil. That is the best thing. Migracode oil will be definitely helpful. Okay. Then Panchakarma procedure which can be given in migraine cases are: one is Taila Dhara, Dashamula Shira Dhara, Abhyanga, Svedana, Pizhichil, Vasthy, Virechana, etc. Thank you. Dear doctors, if you want to explain any, you have any doubt or any case discussion or something, if you want, you can ask.
Yes. Yes, madam. Thank you, madam. Now we are going to start question and answer session. Please, anybody is having any question?
Good evening, sir. Good evening, ma'am.
Good evening to you.
Ma'am, I'm having one doubt. You have told about the Vasthy in osteoarthritis, lumbar spondylosis. All are Kashai Vasthy. If we are giving Matra Vasthy or Anuvasan Vasthy, in osteoarthritis, which type of Matra Vasthy in kottakal you are giving?
Madam, see, in osteoarthritis cases, as I told, we can divide the patient into two categories. Okay, one is we can below 60-year-old cases, early osteoarthritis. We may say mostly in obese cases, below 60 or below 65-year-old lady it is. Then you can definitely go for Erandamuladi Vasthy, Erandamuladi Vasthy. We can go for. Kashaya Vasthy. Okay. And in that case, in Anuvasana Vasthy or Matra Vasthy, you can go for, what to say, as it is a degenerative disease, you can definitely go for Dhanandaram Medupagam or Sahajradi Thailam Medupagam. Even Sahajradi Avartana also can be given. Sahajradi 7 Avartana or even simple Shadahwadi Vasthaila also will help in Anuvasana Vasthy. In Kashaya Vasthy, usually we give here one is Erandamuladi Vasthy or Madhudailiga Vasthy also. Simple Madhudailiga Vasthy also will help in below 60 or 65-year-old degenerative cases if the patient is obese. And if the patient is like above 65-year-old, then again if the patient is obese also, please consider it as a Kevala Vadiga and you may go for Dvipanchamuladi Vasthy or Dashamula Vasthy or in that case also you can give in Anuvasana or Matravasti cases, Dhanidram Medubhaga will definitely help. Avartanas also again this Sahajradi Avartana will be helpful. This is what we will here because we consider osteoarthritis as a degenerative. It is a degenerative disease, but
Yes.
but in we categorize it as a below 60 or below 65-year-old and above 65-year-old like that. That is the common practice we do here.
Ma'am, in rheumatoid arthritis, so if the AMA subsides, so can we give in Janum Basti to the patient if he's having severe knee pain?
Definitely.
So,
Because in osteoarthritis cases, once it progress after 10 year or after 6 or 7 year, and if the deformities have started, then you please consider it after ama pajana, you please consider it as osteoarthritis itself and treat like that. It will give more result.
okay. So, ma'am, in rheumatoid arthritis, the veteran Basti is a choice.
Definitely, Vaidyanavasti is a choice.
Yeah. So if we are giving a veteran Vasti, I'm having a one patient, so I'm giving him a veteran Vasti for 3 days. So he's not having much result with veteran Basti, but as it takes time, I know it as a Amvat condition. So after veteran Vasti, which type of Vasti we should continue for the Amvat condition?
I will explain, ma'am.
Yeah.
There is very simpler procedure than Vaidyanavasti actually. That is what I explained it. Churnavasti.
Yes.
It's a very simple procedure. You have given Vaidyanavasti continuously, ma'am, or you have administered Anuvasanavasti in between, or continuously?
Continuously for 3 days.
Continuously.
With Churna Pindasved. Yeah.
Then you wait for 1 or 2 days, okay, and
Okay.
then you uh, go for Churnavasti. Churnavasti either with Shadharana Churan or with Brihat Vaishwandra Churan. Any ekil eligible, either Shadharana Churan or Brihat Vaishwandra Churan. Okay, 10 gram is sufficient. 10 to 15 gram is sufficient. Boil it in 300 ml of water, 300 to 350 ml of water, or even 250 ml of water is also sufficient. 300 ml of water, 300 to 350 ml of water, you boil it, cool it to the room temperature, and maybe like comfortable temperature you can make it and administer it. Same as Kashayavasti, you administer it to the patient.
Okay.
It will give instant result. If you administer in the morning, by evening, patient will tell, yeah, my fever has reduced, my appetite has increased, my pain is reduced. It will give you instant result for sure. Shadharana Churan or Brihat Vaishnav Churan. Shadharana is the best thing you can do. Okay. As you have administered Vaidyanavasti continuously for 3 days, please wait for 1 day. Otherwise, it will be more Lukshana. Already you have administered 3.
Yes, yes. Okay, ma'am. Thank you.
Okay.
Good evening, ma'am. Ma'am, please elaborate the use of Cherry Antrakotar Gulika in pain management, please.
Cherry Antragudara Guliga in pain management, it is not directly useful in osteoarthritis or rheumatoid arthritis cases. It is useful in acute pain abdomen, like in because of the gastric irritation and all. If pain abdomen is happening, or migraine cases happening in some cases, in migraine cases also, and also in pain abdomen due to blotting of the abdomen, like because of gas, you can use Cherryandra Gudaram Gulika. In severe migraine cases, you can use Cherryandra Gudara Gulika along with Surya Prabha Gulika. 2 Surya Prabha Gulika, what we do here is 2 Surya Prabha Gulika that are small tablets, Surya Prabha. And this Cherryandra Gudara is little bit round, big tablets. 2 Cherryandra Gudara tablets and 2 Surya Prabha Gulika. Powder it and make it as a pouch and give it to the patient. Okay? This is a magic medicine or a wonderful medication for migraine also. And in pain, gastric gaseous abdomen, you don't give Surya Prabha. Simply this Cherryandrudaran tablet along with Mahadhanatran tablet you can give. But this migraine cases, acute migraine cases, you give this 2 Cherryandrudaran along with the 2 Surya Prabha Gulika, powder it and give. Within 10 minutes, patient will be happy. And,
Okay, ma'am, got it. Thank you, ma'am. Last thing I wanted to know that the word Anupana, like we use cumin water for the Cherry Antrakothara. Should we use cumin water? Lukewarm?
No need.
No need.
No need. Not necessary. If you are using best thing, what we use here is not a cumin. Cumin seeds. Cumin seeds you can use. We roast the cumin seeds.
Yes, ma'am. Jeera
Add
can
some.
was written for Cherry
Roast the cumin seed. Add 500 ml of water. 1 teaspoon cumin seed. Roast it. Add 500 ml of water. Then boil it and then that much time. You can just powder it and give.
Okay, got it. Thanks. Okay, thank you.
Good evening, ma'am.
Good evening, Ji.
Ma'am, what is the line of treatment in synovial fluid effusion?
Synovial fluid effusion. In milder effusion and all, you can definitely go for Kottanjukkadi Churan, Jadamayadi Churan, or Rasnadi Churan, Lebana. Okay. Of course, in bigger effusion means you have to go for tapping. But in milder effusion, I'm saying, Kottanjukkadi Churan along with Rasnadi Churan, mixed with warm water. If Dhanyamla is available, you can definitely go for Dhanyamla. You can mix this thing in lukewarm Dhanyamla and apply it on the affected area. and keep it there for 1 to 1.5 hours, and after that you can remove it. Definitely it will be helpful. Okay, Kottanjukkadi
ma'am.
and
Ma'am,
Rasnadi.
one more question, ma'am.
And
What will be the line of treatment in bamboo spine?
which one, ma'am?
Bamboo spine, ma'am.
Bamboo spine. Bamboo spine, see, in ankylosing spondylitis cases, see, in the initial stages, you have to do the acute rheumatoid arthritis treatment itself. It is uh, rheumatoid arthritis line of treatment itself will help in acute cases. But if it goes to the come to a chronic stage, like if the bamboo spine, that fusion and all happened, degenerative changes are more, and there is no signs of AMA, like fever and all are not associated. Swelling is not that much, stiffness is reduced and all, means you go for osteoarthritis kind of treatment, osteoarthritis line of treatment. In the initial stage, you can definitely go for rheumatoid arthritis line of treatment, which is if the patient is associated with the stiffness and all, definitely you go for Amrutotharam Kashayam. Then along with the Vettumaran Gulika, you can give Amrdarishtam, you can give. Then typical that Amaharana Chikitsa, Churna Vasthy, then Valuka Swedam. Sorry, Churnavasti, you can definitely go. Then Churna Pinda Sweda with the Kottanjukkadi Churan or that we here use is Kottanjukkadi Churan we use, then Kola Kulathadi Churan. These things are, we make a potli and do dry potli massages in acute cases. In chronic cases, these things will help in relieving of the fever or feverish condition, mild stiffness, that stiffness condition and all will be helpful in relieving these kind of things. Okay, but in chronic cases, you go for this osteoarthritis kind of treatment only, like Rasnadi Grida, Dhanindra Grida and all you can give. Okay, the degeneration is more chronic case. And then you can go for Pizhichil also, or means Kaya Sega and all also in the later cases. Initial cases, please don't use much oil and all. Dhanyamla Dhara, this Churna Pindasveda, Abhyangam associated with the steam therapy and all will be helpful in treatment side.
Okay. Thank you, ma'am.
Anybody else? There is a question of Dr. Manpreet Kaur. It is in the message, madam. Please tell about Arya treatment, pain management.
Pain management in RA treatment. Yes, sir, definitely. I'll explain. RA cases, what we do here is we divide the case into two category. One is initial category, that is acute category, acute pain that the diseases has just started. Patient is associated with a fever. Patient is associated with loss of appetite or diminished appetite, severe pain, swelling. In this case, oral medication, what we prefer are, one is typical Amapajana medicines. One is Amrutotharam Kashayam. Simple Jwara Chikitsa we do here for that. Amrutotharam Kashayam, otherwise Shadangam Kashayam, along with the Vettumaran Gulika, then Amrdarishtam. These are the things, common things we use here in the initial stages. Okay. Then once the, and also oral medication this, and then that we will definitely give them Churna Vasti with the Shadharana Churan or Brihat Vaishadara Churan. This also will be effective. Then in the treatment side, we usually go for either Dhanyamla Dhara. If the pain is that much severe, we are not able to touch the patient, that much pain it is there, we will go for Dhanyamla Dhara. It is simply pouring the Dhanyamla on the body in lukewarm temperature, nothing else. Then once that acute pain has subsided, then we'll go for Churna Pinda Seda and all in the next stage. And once the Amavastha has reduced, the patient is better now, the patient's appetite has increased, patient's pain has reduced, swelling has reduced a little bit and all, then we will go for the next stage. that is Patra Potless Veda, then Kaya Sega and all in the second stage. In that stage, we usually use the medications, example, Rasne Erendadi Kashayam or Cheria Rasnadi Kashayam, then Kudaharam Kashayam, then Kaishore, also Balarishtam. These things we use in the second stage of the rheumatoid arthritis. Then in that stage, you can go for Kashaya Vasthy like Madda Iliga Vasthy and all. These are the common thing we do here for rheumatoid arthritis.
Another question is, madam, please explain medicine in diabetic neuropathy, neuropathic pain.
Neuropathy. It is difficult, sir. Still, neuropathic pain, neuropathy is a degenerative stage. So we usually go for Dhanyamla Kashayam in that stage. Dhanyamla Kashayam, Dhanyamla Gridam. Then for external application, Dhanyamla Kudamba we use. Then along with Murivenna. Then you can go for Shashtika Shali Pindasveda. We had a Shashtika Shali Pindasveda in diabetic cases. Before using that, we usually go for a mild, milder Virechana or something like that. Virechana, milder Shodhana with Gandharva Erenda. Gandharva Erenda will be helpful. After that, only go for Shashtika Shali Pindasveda, Patra Potlas Veda, Kaya Sega and all. But diabetic neurogenic pain is actually difficult to manage. Pindataila will be helpful. Khajita Pindataila, this Shadadhauda Grida and all will be helpful in that reducing that burning sensation. Diabetic neuropathy, that neuropathic pain, we usually don't get 100% result, but definitely improvement will be there.
Any other doctor, please? Anybody wanted to ask any question regarding the pain management?
Ma'am, can you repeat the treatment for migraine again, please?
Migraine, definitely. My favorite topic. Migraine. See, you check two things you have to check. In 95% of the cases, there will be a chance of gastric irritation. First of all, once the patient comes, you ask the patient about her routine and all. Mostly ladies will be having the pain. In 80% cases, it will be ladies. In 20% only gents will be there. Ask the patient for the routine. Ask about her routine. And to rule out, also rule out any chance of the brain lesions and all. If brain lesions are not there, that is another category that we have to refer. Okay. I'm not talking about that brain lesion part. For a normal migraine case, first patient comes, you ask about her routine. Patient mostly will be delaying her breakfast. In North India, even our kids also, when the kids go to the school and all, they take one glass of milk or very light breakfast and then go to the school, rush to the school. After 11 o'clock, 11:30 only, they will be having the breakfast in school. That's what we teach here from the younger ages itself, young age itself. So normally in housewives also, what they do is after all the house chores and after taking bath, after puja only, they will be having their breakfast by 10:30, 11 o'clock. If you check the migraine cases, in 90% cases, this will be the routine of the patient. Then by that time, gastric irritation will be there. So in that case, what we have to do here is ask the patient to change the lifestyle first. Secondly, you can go for the kashayas. Best thing you can give is Patyaksha Dhatriyadi Kashaya. Patyaksha Dhatriyadi Kashaya. This one. This is Patyaksha Dhatriyadi Kashaya. It is there in the screen. Then along with that, you can give Mahadhanandaram Guliga. Mahadhanandaram Guliga will be helpful in reducing the gastric irritation in patient. Patyaksha Dhatriyadi Kashaya 15 ml mixed with 45 ml of warm water or 60 ml of warm water also will do. Patyaksha Dhatriyadi Kashayam with 60 ml, 15 ml Kashayam with 60 ml of warm water. Then along with that, you give Mahadhanandaram Guliga 2 tablets before food. These 2 medicines should be given before food. And after food, you can use either Dashamula Arishta 30 ml twice daily after food, or you can use Jeeragadi Arishta 30 ml after food, or you can use Cherryandra Gudara 1 tablet twice daily after food. If acidity is associated with this, you may go for Pravala Bhasman capsule along with the Cherryandra Gudara. One Pravala Bhasman capsule and 1 Cherryandra Gudara tablet twice daily after food will do. If you suspect acidity in this case, please don't go for Arishta or Asavas. It will again irritate the gastric lining. So please don't go for Arishta Asavas if you suspect acidity in this case. This will work. And along with that, you can use Migracot oil or Balahadal Thalam for external application on head. And one secret combination also is there. I'll explain. There is one churan called Kachuradi Churan. Kachuradi Churan. KACHOORADI. Kachuradi Churan. This churan, you can take a half teaspoon of Kachuradi Churan on a kattori, in a kattori, and then add a little bit of Shirabala, either Avartana, 101 Avartana, 7 Avartana, or even plain Shirabala also will do. Shirabala Thailam with that. Kachuradi Churan and Shirabala Avartana, 101 or 7 Avartana or 21 Avartana. Kachuradi Churan. Mix with that. Make it lukewarm and apply it as a Shiroleba, like this in this area, vertex area. Just in 1 rupee coin around me, आप apply करने के लिए बता दीजिए patient को on the vertex of the patient. This as a daily routine, at least for a week or 2 weeks, or as a daily routine for 1 month, 2 months also, no problem. That also will be helpful in migraine cases. I'm not saying in acute case, if the patient is having severe pain and we are applying it instantly, you will get result. No, I'm not saying that. That instant result will happen in that secret combination I have told you, that is Charyandra Gudaram along with the 2 Surya Prabha Gulika. That will definitely work wonders in migraine cases which is caused by gastric irritation. These are the common things what we give for migraine. And you may ask the patient to go for Shirothara, like Tailathara with Balahada Thailam, or even Shirabala also will help. Shirabala also. Or if the patient is explaining burning kind of pain and all, then you can ask the patient to go for Panchagandha Kshiradhara. Panchagandha Kshiradhara. That also will be helpful. Panchagandha Churan is available. Boil it and mix it with warm milk. Then do the lukewarm milk and do the dhara. That also will be helpful. And even Panchagandha Churan, what we that medicine is available. Panchagandha Churan, mix with the lukewarm water and apply it as a paste on the forehead. In that also will be helpful in acute migraine cases. If no medicine is available with the patient or with you, you can ask, and then an acute migraine cases come to you and sat in front of you and they are asking, doctor, please give me some medicine. I'm in severe pain. Just do one thing. Ask the patient to drink half a glass of warm water. Hot water, not even warm water, hot water, just like chai. That warm, that hot water. Sip करके पीने के लिए बता दीजिए ना. That itself will relieve the migraine in most cases, because it will reduce that gastric irritation. It will ease that gas. Then that enteric nervous system, that thing will be relieved. That irritation will be relieved. Patient will be better.
Thanks, ma'am. Thanks a lot.
Madam, next question is of Dr. Pritpal Singh.
Okay.
My question is regarding, as we go for Janu Vasthy, sometimes patient complain about aggravation of the pain. What
Yes.
could be reason
Sir.
or how to manage?
Yes, sir. Yes, sir. I will explain. Sir, in some cases, if Janu Vasthy will actually give pressure on the knees, because already knees are degenerated, and they will be flexed also. In most cases, in severe chronic cases, knees will be flexed. वो नीचे नहीं टकराएगा, ऐसे ही होगा, ऐसे degenerated stage में होगा. In that case, if you go for Janu Vasthy, we will be applying pressure for applying that making that pool, and then we will be pouring the oil. Then patient have to lie down still for an hour or 45 minutes at least. Then we'll be pouring. Then that there will be strain on the knees and also on the legs. It will aggravate the pain. In that case, instead of Januvasti, you may go for Janu Dhara. Dhara. Same oil can be used as a dhara on the knee. In that case, patient can sit comfortably on a plastic chair with the back support, if old age patient and all, and do knee dhara with the same oil. That will give better result than Januvasti. Or if you have to go for Januvasti specifically, then give a knee support under the knee with a small pillow or a roll of a towel or turkey towel or something. Roll it and keep it under the knee. Give proper support and go for Januvasti.
Another question is from Dr. Tarandeep Garg. Ma'am, there is a patient having frozen shoulder, Vishwasi, taken 2 injections of corticosteroid, got no relief. I have given her Patrapotli Svedan, Nasyam, and Shunthi Balakshayam. What else can I use?
Sir, in frozen shoulder, initially assess her blood sugar levels and all, uric acid levels. Blood sugar levels also and uric acid levels also, sir. Then if the blood sugar levels are higher and it is if you're suspecting diabetes, maybe undiagnosed patient was not she is not a non-diabetes, and now we are just getting the result that she is diabetic. Then go for the diabetic treatment. If the patient is diabetic, please don't go for frozen shoulder treatment. You go for the diabetic treatment like Kadagadradi Kashaya, Nirudhyadi Guliga, or Nishagada Kashaya. Typical diabetes treatment you can do if the patient is in uncontrolled diabetes. If we find out, there is no need of any frozen shoulder treatment in that case. Then, if diabetes levels are normal, uric acid levels are high, if it is gouty thing, then you go for the gouty treatment there, like Kogilakshagam Kashayam or Brihatyadi Kashaya, Chandraprabha and all you can use in that case. And if these two things are not there, we are ruling out that we have ruled out diabetes also, gouty arthritis also. Then, in that case, oral medications can be given as Ashtavargam Kashayam, Shirabala capsule, Ashtavargam Kashayam 15 ml with a Shirabala capsule 2. Then after food, you may go for Yogaraja Gugulu and 2 Yogaraja Gugulu and 2 Surya Prabha after food. Then in a treatment side, according to the condition of the patient, if swelling and all are there, in initial stages, you go for Churna Pindasveda, sir. Like Kottanjukkadi Churan or even Rasnadi Churan also will give you wonders. Kottanjukkadi Churan along with Rasnadi Churan, make it a pottery and use Karpasasthe Thaila plus Murivenna as oil medium, and apply Karpasasthe Thaila and Murivenna on the area and dip this pottery in Karpasasthe Thaila and Murivenna itself and do pottery. Churna Pindasveda. Even Kottakal Ayurveda has Podikiri. Podikiri is Churna Pinda Sveda, that kiri only. That is available in our market, in our shops also. That kiri, that pottery is available. That pottery also can be used. Give a pottery massage. Then go for Jambira Pindasveda, sir. Jambira Pindasveda also is a very good option. In that, which is very simple actually, that you may take some Jambira is that lemon. Cut some 5-6 lemons. Then add some that salt is known as not sea salt, that crystallized sea salt, no? That also a little bit you can add, 1 or 2 teaspoons of sea salt, and 1 cup of shredded coconut, grated coconut also, and just warm it in, not warm it, just cook it in a kadai with some til taila, normal til tail. Okay, then make it, cook it in a kadai, अच्छे से cook कीजिए ना, अच्छे से कुक करके जब तक वो कोकोनट 1/2 कप और 1 कप कोकोनट, half a cup coconut sufficient, grated coconut sufficient, till that coconut become golden brown color. 3 ingredients only. One is jambira, that is cut lemon, then 1 or 2 teaspoons of crystal salt, and half cup of coconut. Fry it until the coconut become light golden brown. Then make it in a pottery. Dip it in karpasasthetailam and murivenna, lukewarm. Apply karpasasthetailam and murivenna on the affected area also, and do the potli sweda. On the affected area also, on the neck also, on the upper back also, on the flanks also, and also on the chest also, affected area. This will give you result. Usually we get good result with this much treatment.
Okay, madam. I think we have had many questions already, and now the timing is going on. It is time to stop the things, please. We cannot take more questions, please. Well, doctors, I am sorry. Due to some technical disturbance, we were not able to organize the things in right time. So still, I am thankful to madam that she has coped up the things and she had well explained the things. Let me explain about her. Madam Malini, she is graduate from Kannur, Kerala, Government Ayurvedic College, Kannur, from Kerala, and she is postgraduate from SDM College, Udupi.
Yes,
And nowadays she is working as medical officer at Arya Hospital in Delhi.
yes.
Yes,
You're all welcome. कभी
yes.
possible है तो आ जाइए ना hospital
visit
करने के
we
लिए.
will call you again on this pain management with the single diseases. Either we will take osteoarthritis or
Definitely, sir.
rheumatoid arthritis.
We'll be more than happy.
So we will have one by one. So thank you
Definitely,
very
sir.
much, madam. You have
Okay,
done a great work. We are thankful to
Thank
you.
you.
Okay,
Thank you, sir.
thank you.